Hey everybody, Dr. Rob here. You have an ankle sprain? Now what? So many people talk about ankle sprains. So many people have them, and most people don't treat them. What really caught my attention recently was a Washington Post article that just came out that said 25% of sprained ankles were prescribed opiates in the emergency room. It's actually 25.1%. The largest state, believe it or not, was Arkansas, 40%. To go to emergency room because of a sprained ankle and receive opiates is incredible, to say the least. There's no way that should be the instance. Everybody should understand it's not just an ankle sprain, which we'll talk about. Let me share some key takeaways on how to assess it, what it is, and how you can have somebody treat it, and things you can do at home on an ankle sprain. So let's talk about that a little bit. First thing that I want to show you is there's your ankle, or there's your foot and your ankle. So an ankle sprain is what we call the lateral complex, what we call the outside. Typically what happens is you plantar flex, which means you point your feet down and you invert. So you point your feet down and invert, and this lateral complex over here, this lateral complex here, which is made up of 3 ligaments, gets strained and pulled. Anterior taliofibular ligament. That's the most common ligament that is damaged in an ankle sprain. The second most common ligament is the calcaneofibular ligament right here. And the third one, which would be approximately there, is the posterior taliofibular ligament. But this one, anterior taliofibular ligament, is the most common. A couple of key elements. Once again, plantar flex, invert, 3 ligaments. Anterior taliofibular ligament is the most common. In addition, we strain what we call our everters, our peronei up here, or fibularis muscles now. So that's a very common thing. That's a very common overlooked thing when people go in and get assessed. So not only are you looking at the lateral complex, you're also looking at what we call these peroneal muscles, which are your everters. Now, if you understand this lateral complex, let's talk about some of the things that go with how common an ankle sprain is. 28,000 ankle sprains occur daily, large number. Number 1 sports injury in the United States. Basketball has the highest incidence, or the highest rate of an ankle sprain. About 41% of basketball players get an ankle sprain at some point. That's a lot, almost half. Like I said, lateral complex, 55% of people who get an ankle sprain never seek help. So let's look at it like this. 55% of people have an ankle sprain, never seek help, yet 25% of the people who go into the emergency room get a pain opiate, Oxycontin and the like. It's not just an ankle sprain. That was the closing conclusion comment at the 2016 Ankle Symposium. People also who don't seek help say, it's just an ankle sprain. Let me tell you some things that happen with an ankle sprain. 1, you're going to walk differently. You're probably going to walk with a limp. Or as the doctors like to say, you're going to have antalgic movement, or a movement that is atypical of what you should normally have. What happens is when you're walking differently, your body's going to compensate. Number 1, in different muscles. Number 2, your brain is now going to look at your foot and say, wow, this funny way that I'm walking, or abnormal way that I'm walking, is now normal. And one of the big keys when the structures heal is to retrain how you walk, or, as we're going to show you in treatment, your proprioception. Interestingly enough, on this side, which is your right side, when you sprain your ankle, you shut off your glute max, your strongest muscle in your body, not per square inch. So you can't get what we call hip extension. So if you're an athlete or somebody who just wants to walk or perform, your inability to get your hip back is going to decrease your performance rate. So it's not just an ankle sprain. It's not just here. Your body's all interconnected, and your feet and your ankle are critical elements to overall what we call mechanoreceptor or proprioceptive feed. Feed to tell your brain how to move. 80% reoccurrence rate of an ankle sprain, which really speaks to the idea it's 1, the number 1 reoccurrence injury in the United States. 2, people don't take care of it, as evidenced by 55% do not seek a medical or any kind of health practitioner. And a lot of the practitioners are not giving you what you need, or you as patients. something we were just talking about before, are not giving the doctors the amount of time that are needed to have structures healed. Remember, healing is a process. 8 out of 10 people will have another ankle sprain. So with all that being said, with the fact that your same side or ipsilateral side glutes shut off, your hamstrings are going to fire aberrantly, you're not getting proper proprioceptive feed to your brain, the structures probably won't heal on their own. Incidentally, these are ligaments. Lowest blood supply of the major structures in the body. Ligaments, tendons, muscles, and ligaments. Not going to heal fast. Not going to heal well. Not going to have a lot of nutrient-rich blood supply. Not going to enable it to heal quickly. Most people just push off the ankle sprain and think it's not that much, yet it leads you down a very deleterious path for overall musculoskeletal injuries. So let me share with you some key takeaways and key treatment protocols that I've used and accrued over 19 years in practice. And I can happily say I'm very confident and excited when I'm able to work with someone with an ankle sprain. So here they go. Drum roll, please. First thing, chiropractor. Joint mobilization or joint manipulation. So when you look in here, you've got all these different metatarsal bones, you've got the cuboid. What happens is, right here, talus, very commonly known, it's called swan dive or talar dive. It gets stuck. So very commonly, chiropractors like to manipulate this bone, this joint, and open it up. It's breathtaking. It's really almost a watershed moment in somebody's injury recovery when we're able to realign and mobilize the joints in the foot. Remember, ligaments hold bone to bone, so when you have damage in a ligament, those bones that it attached to are not going to be properly supported, so you're going to have certain restrictions. Tendons are muscle to bone, so you also may strain some muscles on the lateral side. Therefore, of course, you're always going to have a bony complex fault. So I'm a big proponent of joint mobilization and joint manipulation. Nobody better than a chiropractor to do that for you. Number 2, laser, low-level laser. Everybody knows that I use a lot of lasers in my office. I use lasers. They have FDA clearances. Lasers, non-thermal lasers, bioconia. They're right here. I'm going to show you them. I use them because they stimulate the healing process. They enable increased ATP, oxygenation, and neurotransmission. They enable you to heal at a cellular level by an exponential rate when we shine the light in. So we've got 2 different handheld lasers right here. As I turn one of them on, here is my accelerate, and my accelerate sends a beautiful beam of a 635 nanometer wavelength. That wavelength mimics visible light. So this enables you to stimulate a healing process. Now, the interesting thing about it is that most people do not feel the light going in. They're used to like ultrasound or hot lasers, and they have to touch the skin or be right here and move around, and they're getting oscillation and vibration. We can be very close or just about on the skin, and the body absorbs this light. Cell membranes absorb this light to get these kind of clinical outcomes that are outstanding. 19 years of practice, ART certified, Factor certified, Gratson certified, all these things, use a laser. I can tell you that honestly, that I'm not sure if I had to give my lasers up, what else I would want to have to, or what I would have to give up. They are without question a priority that I use in my treatment protocol. And then we have what we call the EVRL. The EVRL is very unique because it has a red and a violet light. What I like about the violet light is the violet light's antibacterial, antiviral, and antifungal. So I find these 2 handhelds to be very, very effective to stimulate the healing at a cell level. Healing is a process, as I said before. Healing is very critical to enable that ankle sprain and the ankle structures to heal correctly so we can retrain the body on how to move. Rehab exercises. So here are your rehab exercises. Here are the big ones. Single leg stretching, single leg standing, and specific stretches. Should be a comma there. We won't tell anybody, Steph. And ankle alphabet. So some of the things that we really like, we do a great job. Here's Chiro Up. Chiro Up does a great job. They've got some fabulous exercises that you can use. They're all put out so you can see single leg. If you guys can see, I'm standing on one leg. Specific gastroc and soleus stretches, those are calf stretches. And the ankle alphabet going like this. Web exercises also I use. So we have several different handouts that people can take to do homework or outside of the office, a critical element. My suggestion is in your office, or if you're a patient, have the doctor, have the practitioner show you how to perform them. There's videos. You can get videoed while you're doing them here. You can have the practitioner get videoed. There's the ability to go home and really expedite the healing process. Balance training. If you're able to balance train, here's Performance Health. They've got some TheraBand stability pads. These are great. This is great for proprioceptive training. If you're able to increase your balance training or your proprioceptive training, you're able to decrease your incidence of injury by 38%. The critical element, the biggest element, is the ability not to avoid plantar flexion and to dorsiflexion. Dorsiflexion is the ability to lift the toes up. If you're able to increase dorsiflexion by 11%, you precipitously drop the amount of ankle sprains that you have. So you want to be able to get dorsiflexion and avoid plantar flexion. So that's our balance training. Soft tissue mobilization, do a lot of hands-on, active release, myofascial release. It's really great because it helps with swelling. The laser also helps with swelling. Great choice. And one of my favorite, if not without question, I shouldn't say one of my favorite. My favorite, there's my factor. Big shout out to the Riddles over there. Here you go. Instrument-assisted soft tissue mobilization. Breaks up any muscle adhesions. You can go up the kinetic chain with it. For me, I'm able to use it again to get some of the swelling out, break up the soft tissue, modulate and manage the inflammatory process. A great choice. And finally, not last, but certainly not least, nutritional protocol. So here's what I would recommend. Anybody who's interested in my Dr. Rob's ankle protocol, we'll add a link at the bottom and you can get any of those products that you like. But here's my suggestion. Of course, healing is a process, which means there's different phases. So phase one of the injury, if they come in initially off an ankle sprain, it's going to be very inflamed, or if you will, it's going to be acute. So you want to manage and modulate the inflammation, the swelling, and the like. Big proponent of proteolytic enzyme, trypsin, chymotrypsin, and bromelain. In addition to that, you also want to start to modulate some of the inflammation. And if you do that, I recommend turmeric also with some specific xanthohumol, specific herbs that are good. We call them skirms that decrease inflammation. So you want to get some herbal, anti-inflammatory, anti-pain in there. You want to get a perfect ratio of calcium to magnesium also to release any muscle spasms. Typically, calcium and magnesium in most multivitamins are 2-to-1. However, when you're looking for muscle spasms or splinting after an injury, you invert the relationship, and magnesium is now in a 2-to-1 ratio. So something like that would be great. Fish oils, always a really good choice. Get them in there really, really quick. You get the fish oils in, it helps with cell membrane health. If somebody were to come in on like day 4 or 5, where we have what we call the subacute phase, where there's repair and remodeling. Day 4 or 5, the structures are repairing and remodeling. Most people get an ankle sprain and they wait 2-3 weeks. Scar tissue is already laid. Remember, healing's a process. We're now in the scar tissue. Day 4, repair and remodeling. Specific things that I like a lot are, once again, I recommend, how about some glucosamine and chondroitin, great for joint health. Hyaluronic acid is great because it lubricates the joints. Fish oils, once again, and some unique herbs that help the healing process go on. And then you want what I call prevention or wellness or ongoing care, your multivitamin, your multimineral, your phytonutrients, your fish oils, your probiotics, your vitamin D, and a great fruits and greens drink. Take care of yourself also. I'm a big proponent in this phase also of eating anti-inflammatory foods. Avoid inflammatory foods like very high sugar foods, carbohydrate foods. Avoid any kind of trans fats. Always keep your diet real nice, neat, and clean. Do we have any questions?
Yes. They want to know, does the laser light help with swelling?
Yes. The answer to the question is I found that the laser light to be very positive for swelling. It decreases because it's able to manage and modulate the inflammatory process. It's been a major addition over the last 10 years in my practice. You know, having practiced ART for 16 or 17 years, instrument assisted, which has now progressed to using the factor, I can't say any one I like any better. I'm a big proponent of carrying that toolbox, going to work, and using a multifaceted approach to help with the ankle sprain. One big thing before I answer the next question, you got to retrain and rebalance. Now the problem is patients want it yesterday. I practice. Get that every day. My whole staff is there and they're nodding at me. I feel your pain. As a matter of fact, I may be in more pain than you right now about that. But with that being said, we have to keep explaining to them that it's a process and let them understand the different stages of healing, and as you take them and be the tour guide during that.
Okay, next question from Gerald McNeil.
Hey.
Do you use a nerval scope, and how effective is it or accurate?
I don't use a neural scope. I'm not that familiar with it, so I can't really speak to that.
That's it.
That's it? Well, guys, we try and do something every Tuesday different. We try and do some cutting edge things. If you all could do me a favor and like, click, and share this, we need at least 50 shares. Write a comment. Anybody interested in any of the products, please feel free. Don't forget, we have a webcast coming up. We just filmed it. It was with Dr. Vincent Pedre, all about happy gut. It was a great takeaway. It's about a 50-minute. You're going to learn all about your gut every Tuesday. Share this, like it, click it. Dr. Rob, always yours in health.